Good afternoon. Good afternoon. Welcome to an Awesome Me live chat and with my co-host Dito Arceliana, and we're talking about how to boost your immune system. And it became a big part of anyone's health routine in the new normal, Dito. So, kamusta ka?
Yeah, yeah, that's right. So a healthy optimal body is your best defense against any viruses or diseases that would come our way. Welcome to our awesome Me Live chat with Dr. Joel Lopez, MD. So Dr. Joel Lopez, MD, Anton, is a US trained medical doctor born and raised in Manila. He took up his pre-med in the Philippines, then moved to the US after medical school to continue his studies. So he did his residency program in internal medicine at the Mercy Hospital in Chicago, Illinois. And then he pursued further studies in complementary and alternative medicine, then eventually got board certified in nutrition, anti-aging, regenerative medicine. And then he trained under some of the pioneers in the integrative medicine field. So Dr. Joe Lopez also trained with the best Lyme literate MDs in the US. He has also trained with a group called DAN, Defeat Autism Now. It's an organization that addresses the holistic treatment of autism spectrum disorders. Dr. Joel Lopez is an active member of the American Academy of Anti-Aging Medicine, American College for Advancement in Medicine, the Orthomolecular Health Medicine Society, and is one of the first doctors in San Francisco, California, who incorporated functional medicine into his practice in the early 2000s.
Wow.
So he opened his medical practice in 2013 here in the Philippines. That's why we're so lucky to have him back in his homeland. He is one of the founding members of PRIMA, which stands for Preventive, Regenerative, Integrative Medical Association, a group of medical doctors whose goal is to bring the practice of preventive, regenerative, and integrative medicine into mainstream and establish the standards of its practice. He focuses on preventive medicine, holistic treatments of chronic degenerative diseases and age-related disorders. Dr. Joel Lopez is licensed to practice medicine in the US and in the Philippines.
All right. All right. Good afternoon, Dr. Joel.
Welcome, Doc.
And
Thank you.
most people fondly call you Dr. J-Lo. Correct?
Yes, Dr. J-Lo.
Dr. J-Lo. So, Dr. J-Lo, can you, first things first, can you tell us about your field of integrative and regenerative medicine and your experience against the fight against COVID, para to give the perspective for people watching this live stream?
Sure, no problem. So integrative medicine is a blend of conventional or Western or allopathic medicine, as well as what we call complementary, alternative, or herbal medicine. So there are different names that we use to describe how we practice integrative medicine. Regenerative medicine, on the other hand, is also known as, or popularly known as, anti-aging medicine. So basically, there are a lot of causes of aging, such as oxidative stress, hormonal imbalance, nutritional deficiencies, or too much exposure to electromagnetic frequencies. So all these things contribute to aging, and there are actually ways to slow down or reverse the signs and symptoms of aging.
Okay.
Regarding my experience with the COVID-19 pandemic, so I've been recommending people to take care of the basics, such as better nutrition, exposure to sunlight, ideally if we're not in a lockdown, exercise, of course, hydration, and trying to alkalize your pH by eating more of the anti-inflammatory foods, such as vegetables and fruits or nuts.
Yeah, Doc, I think that came out today at your in your PhilStar article. That was a great article, by the way. And
Yes.
we would like to invite you back on another show so that we can talk about those 5 basic health basics, so you can explain it in depth. But would
Okay.
you kindly give us 3 immune boosting hacks that people can do now from their home? Because it's we have to have like this home routine every day.
Yeah, so ideally we should have a good diet. But of course, in a lockdown, we're limited by what we can eat. So if you're not able to eat a whole food based diet or plant based diet during this time, it would be ideal for us to supplement with supplements or food supplements that could actually help boost our immune system. Among these ones include vitamin C, which at a low dose it's a good antioxidant. The RDA is 75 milligrams for women, and in men it's 90 milligrams per day. So this would just prevent the occurrence of scurvy. But if you really want to use it for its antiviral properties, you have to use at least 3,000 to 6,000 milligrams per day of vitamin C in divided doses. Then the next supplement I would recommend, since we're not getting enough sunlight, is vitamin D3. So vitamin D3 is not only a vitamin, but it's also a prohormone and an immune modulator. Meaning if our immune system is low, it could actually bring it up, such as in immune deficiencies. And it could also lower your immune system if it's hyperactive. This is seen in cases of autoimmune disease and in allergies. So ideally, we should get at least 5,000 to 10,000 units of vitamin D3, especially during the winter months in the temperate climates, and in the tropical countries like ours. It's important to use the same dose during the rainy months. That could prevent a lot of viral syndromes. And then other supplements would include zinc. Zinc has an antiviral property. So what it does is that it prevents viral replication inside the cell and also transcription of viral proteins. So it's really important in the fight against the COVID-19. Another mineral is selenium, which is important in the production of an antioxidant that we produce in our body called glutathione. So if you're deficient in selenium, you won't be making enough glutathione in the body. And then finally, among the top 5 supplements I would be recommending is bioflavonoid called quercetin. It's a natural antihistamine, but it's also a zinc ionophore, meaning that it could help the transport of zinc into the cell, where zinc could function as an antiviral.
Yeah.
And that's found in lots of fruits and vegetables, such as red apples. It could also be found in red onions, as well as green tea.
Yan yung zinc, no, Doc? There's a question from Romain on what's your take on zinc to boost immune system. So,
Yeah.
do you need to take it more often ba? Or what's the recommended
Yeah,
dose?
the typical recommended dose, especially during this time, is 40 milligrams of elemental zinc per day.
Gaano kadami yan?
It's available in like a pill of like zinc picolinate, 200 milligrams. So you could get 40 milligrams of elemental zinc from 200 milligrams of zinc picolinate.
Okay.
Yeah, and a natural source for that would be oysters.
Pero wala yata tayong mga oysters.
Wala oysters.
Anong pwede sa bahay na with zinc?
Other sources include seeds like pumpkin seeds.
Okay.
Yeah.
Okay, so food sources. Yung mga food sources, Doc. What are food sources rich in zinc? We said pumpkin seed. Okay.
Yeah, and oysters, like I said. Yeah, so
all right, oysters.
Why a lot of guys who have low libido, they eat oysters because it's something that would help improve their hormonal balance.
Okay, I see. Okay, all right. And then, Doc, I meant to ask you because I follow you on Facebook, and you had like this post about the virus being pH sensitive or something like that. Can you explain that?
Yeah, a lot of chronic disease, including infections, thrive in an acidic environment. So if we alkalize the body's pH, then this infectious particles won't be as active. So that's another way of like improving your overall health status is by alkalizing your system, and you could do that by eating more of a plant-based diet and taking
I
supplements
see.
that do the
Okay.
same thing.
So
Yeah, I
walang
think you've covered some of the supplements that are essential to the fight of COVID. But what kinds of products do you recommend for, let's say, for gut health?
Yeah, I recommend probiotics, but if you cannot get probiotics, you could also get it from fermented food. So these are like kefir,
Oo.
sauerkraut,
Mm,
and in Philippine traditions, you could have like achara, which is
Chara.
fermented papaya.
Ah, yung
Okay,
asawa ko
kimchi.
gumagawa, kombucha. Pwede yan.
Kombucha,
Yun.
yeah, that's great. That's great too.
Oo.
Okay, that's really nice. Oh,
Kombucha
okay,
with
yun.
ginger. Oo, diba?
Yeah,
Um,
so Doc, final thoughts naman on the right health mindset that we should be taking, no, and boosting our immunity in this post-COVID world. Uh, yeah, so any final thoughts on that?
Yeah, so basically, it always comes to the basics. So having good nutrition, getting enough rest, exercise, sleep, and then of course sunlight ideally. And if you're not able to do that, just take the supplements that I recommended earlier. So the top five
Okay.
boosting health boosting supplements or immune boosting supplements are vitamin C and D3, the mineral zinc and selenium, and the bioflavonoid quercetin.
So Doc, if people want to know more about all this, no, how can they contact you or follow you?
Yeah, they could check out my website at jlopezmd.com, or they could try to find me on YouTube at Dr. J. Lopez MD. Or, yeah, that's about it.
yes.
Wow, thank you, Dr. Joe Lopez.
May
Thank you for
question.
questions. Yes.
May additional question pa coming from meron kasing recent article. We'll share the recent article. There's this recent article in New York. No, Como was saying it's shocking that most coronavirus hospitalizations are people staying from home. How could that be possible? Maybe, and that's the immune system, ba? Or is the virus are able to get into the home? Or what's your point of view, Doc J?
Yeah, because the incubation period supposedly is between 7 to 28 days. So it's possible that before the quarantine, some people were already infected. And of course, a lot of everybody's indoors, and that would also suppress the immune system. So if you're, let's say, indoors and exposed to just a little bit of virus, then you could actually get symptomatic. So that's how I would be able to explain that.
Is it possible ba na mag-degrade yung immune system? Is that possible? If you do, let's say you do nothing to boost it, is it possible that your immune system would degrade by just staying at home?
Yeah, definitely. Because if you don't have enough access to nutritious food, of course, sunlight is really important. Because, like I said earlier, vitamin D it comes from sun exposure, and you actually produce antimicrobial peptides when you're exposed to the sunlight. So this antimicrobial peptides actually fight against bacteria and viruses that we're exposed to on a regular basis. Yeah, so definitely the immune system could deteriorate while locked inside our homes.
Yeah.
So
And
Doc, what is the best time of day to get the vitamins from sunlight?
ano ba? Yes.
Yeah, there are
Martin.
two schools of thought. One says that it should be between at least before. I mean, it should be before 9 a.m. or after 3 p.m. And then the other group says it has to be during the midday. I would go for the first one though, before 9
The first one,
a.m.
so morning. Morning
Yeah,
is better.
yeah.
Okay. And then Doc, you mentioned sleep because sometimes I lack sleep. What is the best
Nako.
time to go to bed? so that you really,
Yeah,
maximize your rest.
ideally before 11 a.m. because that's when the body actually secretes regenerative or healing hormones like melatonin and growth hormone.
Wow, okay. Pwede pa
Alright.
pala ako lumaki.
Pwede pa. So, we just want to acknowledge if there are any questions, just put it in the comments. Hi to Joe. Hi daw, Doc Joe. And I think we had a discussion nga a while ago with Melanie Tengo about indoor environment, parang making sure na yun yung toxins hindi mapunta sa body mo and stuff. So maybe you guys might want to watch it watch
Hmm.
in the stream. Wait, there's one more question. Wait, okay. There's another question from Romaine. Hi, Doc. Okay for you to explain on viral load and its effect on the immune system. Can you?
Yeah, viral load means the amount of viruses that you're actually exposed to. So if you get a lot of virus, let's say through contaminated mask, you're more likely to develop an infection. Of course, it also depends on how good your immune system is. So if you are exposed to a lot of viruses, but you have a great immune system, then you won't get sick. But if you're exposed to a few, let's say, a small number of virus, but your immune system is low, then you could get sick. So it's a delicate balance between your immune system and the viral load.
Okay. Any other questions? Sandali. We'll finish all the questions first. Yun, I think what is important is this is just our general discussion on boosting your immune system. We'd like to invite everyone to stay tuned for succeeding shows on this awesome series. This is the first of many, and we'll be talking to Dr. JLo in depth on different items, no, like gut health, or we'll talk about with other people also on fitness, lifestyle modification system, plant-based nutrition, which is as Doc JLo said, very important to alkalize
Very
body.
important.
Yeah, very
Yes. Yes.
important. So, ikaw dito,
Yes,
do you have
Anton.
any last question?
Yeah. So I'm really excited about the series of show that we are going to launch in a few weeks. Like you said, we will have somebody who's talking about plant-based nutrition, and then there's going to be someone who's going to talk about fitness, gut health, and I actually just confirmed that we're going to have someone who can help us grow our own vegetables in our own balconies on lockdown. So I'm really excited about that, Anton. So, and of course, Dr. JLo will be coming back for more in-depth discussions about wellness.
All right. Any final words, Doc? Final advice to our audience?
Yeah, so it's really important to go back to the basics. And this is what actually the lesson that we're learning during this period. So family is really important, faith and friends, and of course taking supplements like vitamin C, D3, zinc, selenium, and glutathione, and going back to the other basics like good nutrition, and getting enough rest, sunlight, sleep. Yeah, and that's about it.
All right. Thank you. Dito, any final words, advice?
Well, thank you very much, Dr. JLo, for your time. I know you're very busy. You're always on Zoom calls with your patients, and we can't wait to have you again to discuss in depth about the kinds of supplements and superfoods that we can take while on lockdown to be integrated into our own diets and lifestyles. So
All
that's
right.
it, Anton.
Thank you.
Yeah.
All
Thanks for
right.
having me.
Thank you, Doc. Thank you,
Thank
Doc.
you.
Pino. Thank you, Dito. Anton Diaz here of our
Thank you,
awesome
guys.
saying,
Thank you.
All right.
Thank you.